The tooth position shots are the ones that are the smile from 3 views, and the rest, the E, the tip down smile, and the profile shot. And so for this, setting the camera up, we're simply going to turn the camera on. We're going to touch the back of the screen, go to the mode, and we're going to select the standard. Now the only thing that needs to now happen is we need to use our right thumb and move that over to essentially where the little picture is at a half. And what this will do is tell us that we need to be about 11.8 inches away from our subject. And so this is, again, sending the f-stop for us, the distance, all the lighting from the flashes will be set properly. We'll show you how to position the patient and be able to expose a good picture. So we're going to begin now with the shots that we're going to take chairside, and we're going to begin by getting this patient sitting on the side of the dental chair. We find that one of the most important things is for the patient and the photographer to be facing one another. Most dentists or assistants are taking pictures with the patients laying back, and that leads to a lot of trouble with getting the angles right. So again, we're going to get the patient's head positioned properly, where her interpupillary line is parallel with the floor and that her head is tipped slightly forward. These first 7 shots are going to be about the smile and those critical shots that we utilize in our Dawson Diagnostic Wizard to verify the tooth position. So here again, we talked about how to set up the camera previously. Just get that camera at the level of her nose, have the patient have a nice relaxed smile from the frontal view, and expose the picture. We're now going to go ahead and do the left and right lateral shot. Now for the left and right lateral, you just want to come in and aim that camera on a tangential line off the lateral incisor. And notice how the assistant can easily slide around to the opposite side, aiming at the lateral incisor again and exposing that picture. Now we're going to do the incisal edge position ones, and the first one we're going to do is the rest position. Remember, with the rest position, we just want the patient to sort of relax and just let their mouth fall open. And in that, we're looking at how much of the maxillary teeth are exposed at rest. The second shot we're going to do is the E position, and we're going to have that patient say an exaggerated E and take that shot. Now we're going to look at where the incisal edge is in relationship to the inner vermilion border of her lips. So we're going to have her smile and drop her chin down and shoot in at an angle so that we can see specifically where those incisal edges are in relationship to the inner vermilion border. And then the last one is a profile picture. So we're going to need to turn the patient's head a little bit, and you want to shoot in from a right angle. Be sure you're coming in all the way from the side. Those are the 7 pictures that we're going to take. And notice, Kristen did this extremely rapidly once the patient was set up properly.